This study was a retrospective study of 458 patients from 10 academic centers that my colleague Dr. Talabadar and I analyzed to look at how patients did based on their assessment of their MRD status by measuring the BCR-ABL gene rearrangement. So we know that with the introduction of tyrosine kinase therapy to patients with Philadelphia chromosome or BCR-ABL positive acute lymphoblastic leukemia, that the prognosis has improved considerably compared to when we used chemotherapy alone. We also now have the ability to measure their measurable residual disease status by measuring the BCR-ABL gene transcript. So we looked at the patients who had achieved an undetectable BCR-ABL gene rearrangement with a variety of therapies that generally included a tyrosine kinase inhibitor to see what factors predicted their ability to achieve an undetectable BCR-ABL transcript. And we know that patients that achieve an undetectable BCR-ABL transcript have a better prognosis than those where it's still detectable. And it's called into question whether these patients still need to be transplanted. Because in the past, we felt that all patients with Ph-positive ALL or BCR-ABL ALL should have a transplant to try to improve their survival. So in these 458 patients, we found that patients that had a high white count that had a P210 BCR-ABL transcript, and there were about 22% of those patients. If they had additional cytogenetic abnormalities, or if they received less intensive chemotherapy, they didn't tend to do as well as the patients that had a P190 transcript, for example, and received intensive chemotherapy.